Hey, everybody out there in Facebook land, this is Dr. Raiders checking in from Raiders Spinal Health Center in Vernon Hills. This is my patient, Courtney. Courtney, wave to the camera. There you go. Hi, everybody. Yeah, I know, totally weird talking to a camera, right? But the reason why we're checking in right now is Courtney actually is a brand new patient in my office, and she's a student at Mizzou. Look at her representing right there. But the reason why she's here this summer is she's home for the summer, and she actually has a scoliotic curve in her spine. And Courtney, when you first knew about your scoliosis, how old were you?
12.
She was 12. So she initially was diagnosed with a scoliosis at 12. And did you have any symptoms at that time?
No.
No symptoms. So asymptomatic at that time, which is very common in a lot of people who have scoliosis. The problem is now that you're 20, right? You're 20 years old, and as she got older, she's noticed that her curve may be getting bigger. She thought it was getting bigger. So her and her mom wanted to get it checked out. And she also was starting to get some pain in that upper right shoulder blade area,
yes.
Right? So you're starting to get some pain, some discomfort. And it was becoming more consistent, more frequent, more constant, right?
Yes.
And so the main thing is when she was in her teens, her curve was probably at I think her mom said in the teens as far as a Cobb angle goes. A Cobb angle is actually a measurement of a scoliotic curve. Anything over 10 degrees is considered a scoliosis. Anything over 25 degrees, they want to put a brace on you. Anything over 40 degrees, they a lot of times want to do a fusion surgery. So what we're trying to do with Courtney is reduce the size of her curve without having to use a brace and without having to go through a surgery. So as we did Courtney's initial workup, we actually determined that her Cobb angle is now at about 29 degrees. So it actually has gone up since the last time you've had an x-ray, right? And the main thing for you is, number one, getting you out of the symptom, right? We want to get you out of the symptoms. And I think since you've been coming in a few weeks now, right? And has your symptoms in your upper back gone away pretty much?
For the most part, yeah.
Yeah, for the most part. But we know that the curve is still there, correct? So the great news about Courtney is she is home for the summer, right? So we have about 2 to 3 months to work on Courtney's scoliosis and get that curvature reduced. And if we get the curvature reduced, not only is she going to have more function, she's also going to keep those symptoms from coming back. So the main thing for you, Courtney, is you're doing great. You're going through the care. You're going through our scoliosis program. Everything's going really well. We just want to make sure you continue the success. And tell someone who may have a scoliosis and may not be feeling anything, why they should come in to get checked out, even if they're not feeling symptoms. Like, why should you do that?
I just think then you can be more mobile and do different things that you're not able to do if you have that curve in your spine.
Sure, right? So it's a quality of life issue, right?
Yeah.
You can do more things, have less discomfort while you do it, and your body functions at a higher level.
Yeah.
Perfect. Awesome. And we appreciate you, Courtney. Thanks for taking time out. I know this is your favorite thing to do, Facebook Live. So I appreciate you taking time out. So I appreciate it. Thank you.
Thank you.
Okay.